everyone, today we'll be discussing about renal injury scale. That is a 2018 revised American Association for Surgery of Trauma scale in grade 1. First we have a kidney, we have an ureter, pelvis, renal pyramids, we have a medulla and cortex, we have a renal capsule, we have a perirenal or perinephric fat, and surrounding it we have gerontospacia. Major calyx, minor calyx. So what happens in grade 1? In grade 1 we have subcapsular hematoma and parenchymal contusion without any laceration. We have a subcapsular hematoma. There may be or might not be a parenchymal contusion without any laceration. Okay. Then gerontospacia, perinephric fat will be normal, and ureter, pyramid, nothing is involved. Collecting system is not involved. There is no laceration. Grade 2. In grade 2 we have perirenal hematoma. Perirenal hematoma, this is gerontospacia. Perirenal hematoma which is confined to gerontospacia. We have a renal parenchymal laceration which is less than 1 centimeter depth without urinary extravasation. So collecting system is not involved. There is no any urinary extravasation. There is just perirenal hematoma confined by the gerontospacia. There is a renal parenchymal laceration which is less than 1 centimeter depth without urinary extravasation. This is grade 2. Grade 3. We have renal parenchymal laceration more than 1 centimeter depth without collecting system rupture or urinary. In this also there is no any urinary extravasation or collecting system rupture. So there is a laceration. We have a laceration which is more than 1 centimeter depth without collecting system rupture or urinary extravasation, and any injury in the presence of vascular injury or active bleeding within the gerontospacia. To grade 4. We have a parenchymal laceration which is extending into the urinary collecting system with urine extravasation. This is the ureter, this is the renal pelvis, this is the laceration which is extending into the collecting system. Then there is an injury with urine extravasation. Then renal pelvis laceration or complete urethropelvic disruption. We have a renal pelvis laceration or complete urethropelvic disruption. Enter or complete kidney infarct due to vessel thrombosis without any active bleeding. There will be segmental renal vein or artery injury. We have a vein, we have an artery. There is a segmental renal vein or artery injury. There will be a kidney infarct due to vessel thrombosis without there is an active bleeding which is extending beyond the gerontospacia into the retroperitoneum or peritoneum. Grade 5. Main renal artery or vascular laceration or avulsion of the hilum. We have renal artery, renal vein, laceration or avulsion of the hilum will be present. There is devascularization of the kidney with active bleeding. There is shattered kidney. The kidney, there is a loss of identifiable parenchymal renal anatomy. The renal artery, renal vein, there is a main renal artery, renal vein, laceration will be there, avulsion of the hilum will be there. There is devascularization of the kidney with active bleeding. There is shattered kidney. This is grade 5. So normally in these cases, contrast enhanced CT will be done, mainly arterial and portal venous phase for vascular injuries. Collecting injury, if there is collecting system is injured, like we have clinical features like hematuria, blood at the meatus, delayed excreta phase. It is up to 5 to 15 minutes of delay. Look for urine extravasation. Grade 4 renal injury, the risk of developing hypertension due to decrease in renal blood flow, one of the cause for developing hypertension. Another cause, secondary to compression of the renal vessels due to page kidney leading to an activation of renin angiotensin system. So grade 4 injuries, they have risk of developing hypertension. Vascular injuries, we have pseudoaneurysm or AV fistulas. They appear as focal collection of vascular contrast which decreases in attenuation on delayed images. So vascular injuries, it can present as pseudoaneurysm or AV fistulas. Once you give a contrast on delayed images, there is a focal collection of vascular contrast which decrease in attenuation on delayed images. Active bleeding, it's a focal or diffuse collection of vascular contrast which increase in size or attenuation on delayed images. Thank you.